Globally, weather patterns can influence asthma symptoms in various ways, with regions experiencing cold climates seeing increased incidences of asthma attacks due to the cold, dry air, while tropical and subtropical areas face challenges from high humidity and prevalent allergens like pollen and mould. Seasonal changes such as monsoons or dry seasons also contribute to the fluctuation of asthma-related issues, making weather a critical factor in asthma management worldwide. Dry and or cold air are both triggers for airway narrowing, otherwise known as bronchoconstriction or bronchospasm. Cold air can especially affect you if you suffer with exercise-induced bronchoconstriction, which is otherwise known as exercise-induced asthma. When you exercise, you breathe faster and deeper because your body needs more oxygen. You usually inhale through your mouth, causing the air to be drier and cooler than when you breathe through your nose. Exercise that exposes you to cold, dry air is more likely to cause asthma symptoms than exercise involving warm and humid air. Some types of weather can trigger asthma symptoms, including high heat, cold temperatures, high humidity, sudden weather changes, rain and thunderstorms. We also know that extreme weather can irritate the airways more than milder weather. Weather can also affect pollen counts, which can be a cause for asthma symptoms in those with allergic asthma. Climate change, which is an extended change in weather patterns, can also affect health. And with the increasing temperatures and more severe storms that we see, people with asthma are at higher risk of weather triggering asthma flares. Studies suggest climate change can actually cause asthma as well. Thunderstorms can trigger your asthma, causing asthma attacks and making symptoms like breathlessness, wheezing and coughing worse. Sometimes this is called thunderstorm asthma. Thunderstorm asthma is rare and does not affect everybody with asthma. So far, data suggests that you will have a higher risk of getting thunderstorm asthma if you have asthma and hay fever at the same time, you are not managing your asthma well and using your preventer every day, you have asthma but have not actually yet received a diagnosis. There is also evidence that younger adults, those under 30 years of age, are more affected by thunderstorm asthma. Scientists do not fully understand why thunderstorm asthma happens, but it has been linked to the wind. During a thunderstorm, the wind blows pollen grains and fungal spores into the air. The air during thunderstorms is extra moist. This moisture can break pollen grains and fungal spores down into smaller pieces. These smaller pieces can get into your lungs and affect your breathing. So, in order to protect yourself from thunderstorm asthma, try to essentially keep your asthma well managed. Stay indoors before, during and after thunderstorms. It's a good idea to keep your windows closed too. If you have to go outside, wear a mask to protect yourself against pollen grains. If you have hay fever, take hay fever medicines to help protect yourself against pollen. Always keep your reliever inhaler with you so that you can use it quickly to treat asthma symptoms in an emergency. The largest thunderstorm asthma event recorded globally occurred in Melbourne, Australia on Monday the 21st of November 2016. This was the first hot day of the year with temperatures in the high to mid-30s following a wet and warm spring. A severe thunderstorm warning was issued mid-afternoon. The storm moved from the west of the state of Victoria, with the storm front moving across the region of Melbourne from about 5 o'clock in the evening. 6 o'clock in the evening onwards, the healthcare sector saw a surge in patients complaining of shortness of breath with respiratory or asthma-related symptoms. The ambulance service, hospitals and emergency departments, general healthcare providers, all felt the strain of increased service use, which continued into the following morning. Ambulance calls saw a 73% increase in call-outs. Emergency department presentations increased by 58%, and the number of people presenting with breathing issues increased by 672%. Asthma-related hospital admissions increased by 992%, resulting in 30 intensive care unit admissions, and following a coroner's inquest, 10 deaths were associated with the event. If you suffer with hay fever, it's important to manage your lung condition well at the same time. Follow your asthma action plan, if you have one, issued by your health practitioner or your physician. And it's also a good idea to check out your local pollen forecast every day. Here are some more things you can do if the pollen counts are high. Try to avoid drying your clothes outside, particularly after midday, as they could get high levels of pollen on them, and then you'll be bringing those high pollen counts indoors with you. Try to avoid cutting grass or walking on the grass if the pollen count is high. Try to avoid spending too much time outside on very high pollen count days. And smoking tobacco can make your symptoms worse. Try to get help to stop smoking. Also, avoid keeping fresh flowers in the rooms where you live. Other things you could take, if they're safe for you to do so alongside your other medication, are antihistamines, which are medications that help relieve hay fever symptoms and allergies. Most people with hay fever will be able to manage their symptoms themselves by taking antihistamines. They come in a lot of different forms, such as tablets, nasal sprays, liquids and eye drops. You may need to try different types to find out which one works best for you. Your pharmacist can help you with this. You may feel a bit drowsy using some antihistamines, so again, ask your pharmacist if they can direct you to non-drowsy antihistamine medications. If you know when your hay fever symptoms usually start, it's a good idea to begin taking antihistamines for 2 to 4 weeks before this time. This will give you the best protection and get antihistamine medication on board before you start suffering. You can take antihistamines throughout the pollen season. Steroid nasal sprays use small amounts of steroids to reduce the swelling in your nose so that you can breathe more easily. Remember, your nose is the part of the lungs that we can see. Therefore, it's important to keep the upper airways, your nose, nice and open and free of symptoms so that your lower airways, your lungs, actually can breathe more easily. So intranasal steroids help to relieve symptoms like sneezing and a runny or blocked nose. You can buy some types of steroid nasal spray from shops like pharmacies and supermarkets, but others are only available through prescription. Your physician or pharmacist can tell you about the different types of nasal sprays and which one would be best for you. If you know when your hay fever symptoms usually start, try to start using a steroid nasal spray 1 to 2 weeks before this time, and this will give you the best protection. Steroid nasal sprays are safe to use with antihistamines and very often are used alongside them. To use your nasal spray, first gently blow your nose. Shake the nasal spray well. Take off the cap and hold the nasal spray in the opposite hand to the nostril into which you are going to use the spray. Tilt your head forwards a little bit. Place the nozzle just inside your nostril, pointing it slightly outwards and away from the centre of your nose. This helps the medicine to get to the right place and helps to avoid side effects. Some brands recommend blocking the other nostril with your finger. Just follow the information leaflet inside the box. Press the button on the side or press the pump down and breathe in very gently through your nose. don't sniff hard, take the nozzle out and breathe out through your mouth. If you've been told to use a second spray, repeat these steps. Then use the same technique to use the nasal spray in the other nostril. When you've finished, wipe the nozzle and put the cap back on. If you're using the correct nasal spray technique, it shouldn't drip from your nose or go down the back of your throat, nor should it cause nosebleeds. 2 other good ideas that will reduce your exposure to pollens include buying a pair of wraparound sunglasses. That is, buy some glasses that actually cover the outer edges of the eyes as well as protect your eyes at the front. This avoids pollens going into the eyes and causing that itch-scratch cycle. The other thing you can do that is very effective is apply some Vaseline or petroleum jelly beneath your nose to trap the pollens before you inhale them. This can greatly reduce your exposure to pollens as well. Do remember, if you use oxygen or are within the vicinity of anyone who is using oxygen, you should never use any products that contain petroleum jelly or petrol. Subscribe free of charge to see more.